Hey guys, this is Stephanie.
This is Ariana.
And you already know what goes on this podcast. If these scrubs can talk, why? Because they have got a lot to say. Man, it's been a minute. It has been a minute. And life has been lifing, whether good or bad. But from our last episode, we talked about how we were trying to learn what kind of learner we are. So if you find out what kind of learner you are, will kind of help you with, you know, being able to develop study habits and being able to understand things that make sense to you. So I think in our last episode we talked about if you're a visual learner or if you're auditory or so there's a lot of stuff like in terms of like what type of learner you are. So I hope you had an opportunity to go and take a look at that. If I didn't share the link, please forgive me because Ariana and I we have
No. The link is on the link tree.
Oh, it is. Oh, it is on the link tree. Duh. See, I didn't know that. But yeah, but definitely if you had an opportunity to go take a look at that, please go do so. But what are we going to talk about today? So
today we're getting down to the basics. Okay, what you need foundationally, because you can't be a good nurse and you don't know all the way from the bottom all the way to the top. You know?
Started from the bottom, now we're here. I feel like we're still in the bottom.
So today we're going to be discussing our experiences during our first semester of nursing school, but specifically in clinical.
Yay.
Yeah, so we're going to get to that in a second because we had some side-eyeing experiences.
Bombastic!
But yeah, so we're going to be learning, we're going to be discussing, all the way down to bed making basics. Why even that is so important to patient care. We're also going to discuss the art of the interview, your bedside manner, and the scariest part, talking.
If that ain't scary, I don't know what about nursing ain't about scary.
So at the end, we'll put all of the knowledge and all of the teachings together and try to give you some type of concise takeaway so you can apply it into your clinical experience.
And yeah, definitely, because we're still in the learning process, you know, the nursing process, everything is a process. So I guess for us, like what we're trying to really do is for some of the key takeaways for this episode is we want to give a lot of good points, right? So these points that we want to break down to you, especially in the art of the interview, I feel like this will help you kind of understand being able to build that confidence to talk to a patient. It takes so much bravery on your first day of clinical to walk into a room and say, "Hi, my name is." Mm-hmm. That alone is the scariest part that I could think of once you're in that room, because it can either go down real quick.
Yeah, because we have to remember it's like an order of operations.
Yes.
We're not allowed to deviate from the order of operations. So like we work as medical assistants, you could kind of like, improvise,
Finagle,
do what you need to do, and you feel comfortable with it. But now you're like in the clinical setting, you're like, okay, you have to do 1, 2, 3, 4, and it's like,
And if you miss a step, you're like, oh shit, yeah, I gotta go back. It's like,
yeah,
so it's terrible. So it's like starting from the beginning and definitely being able to kind of understand how do we build that confidence and able to talk to a patient, and especially the art of the interview. It is an art and it is a science, and they don't always teach you that. So you know what I mean. And also talking about the nursing process and the clinical judgment model, along with vital signs and definitely nursing foundations, is what we've been struggling with.
Yeah. That's a particular class.
That is a particular class.
Through, the first semester, and our first semester is.
I don't know how to move on. How do we move on from that? You know, like when your egos hurt? Like, my ego hurts.
I swear we know what we're talking about. I swear. I promise you.
I would think.
What we're talking about.
I would think.
But this class leaves us disheveled in pieces.
I couldn't find the right word. You just put the right word to define what this class has done to us.
Yes.
As individuals and as students. We have left disheveled.
Yes. I feel like all rumpled up, like I just woke up out of bed, don't know where I am.
Fucking hating this. I don't know what fucking day it is, what time it is, what day of the month it is.
Where I'm in no time soon.
Oh my god. Yo, we're not A&O0. We are A&O0 for sure. I don't know my name. I don't know my place. I don't know my person. I don't know why I'm here. Oh my god! But I think as nursing students we share that. That is what brings us together as a community.
Oh. Oh gosh.
Oh my god.
We've had a time. Since our last recording, it's probably been it's been about 4.
I was gonna say 5 weeks.
Yeah. A lot has happened in 5 weeks. We've had 4 tests. 1 week off.
1 week off.
And then next week we have a week off, then Thanksgiving.
Yeah.
And then it's finals.
We literally have 3 weeks work, I can't even fucking talk. 3 weeks left of lecture, right? And then what in our school, what we have a makeup week for those that might have been absent, or if they needed to make up a class or a lecture or a lab or whatever the case may be. But that time is you have that time to study, whatever the case may be. And then we technically have 2 more clinicals left.
Crazy.
Already.
Just started.
We just started. And now
I'm sad but I'm tired.
Ariana has been with the sinus infection. I myself has been in and out of the hospital. Oh my god.
We were taken down.
Like on some real shit.
No, Stef was literally taken down.
I knew you were gonna fucking say that. Alright, so backstory. So
story time.
So in health sciences and in schools in general, stop your fucking laughing. Let me get to the fucking story. Okay, so in health sciences or in medical schools, there is a thing where they have a pinning ceremony. So the pinning, not the pinning ceremony. Pinning is when you graduate. Sorry, my fault.
Your white coat ceremony.
Yeah, it's a white coat ceremony. So this is kind of like transitioning, coming from you're finishing your prereqs, and now you're actually in the clinical phase. Stop fucking laughing. Oh, this is so mean. So what had happened was we were doing a practice with our professors in the stage. So we're walking down and she's telling us you have to walk down the aisles and we have to get ready to set up. They're gonna call your name.
We weren't gonna do a rehearsal.
We weren't gonna do a rehearsal originally. Thank the Lord, we did. Okay, so my name gets called. I'm walking down the aisle. I was supposed to be seated in the second row, but the professor was insisting, no, sit in the front row because your name starts with an M, whatever. So I go and I find my seat. Next thing I know, she's choking. She's literally choking. Next thing I know, okay, I'm sitting in the chair and I'm flat on my back. Okay, I'm talking about. I went back. For everybody else's memory, they said that I went back very slowly. For me, it was a flash. Like I hit the back. Fucking broke the chair, okay? Fucking legs straight up in the air. And the first, you know what my dumbass asked? Did anybody catch that? Did anybody catch that on video?
My first reaction was...
Yo, I was fucking done for. Now, here's the thing. Adrenaline is going on. I'm embarrassed and I'm taking a breather because I didn't realize how hard I hit myself. So I got up, but it took me a minute just to get up because I was literally laughing and crying at the same time. I laid on my side, feet are up, up there for a second. And then there was a person that was behind me. She was literally standing over me, and I think she was just like frozen
Her
because
spins like caught your head.
Yeah, that's basically what happened. Because as soon as I and I was like, oh my god, what the fuck just happened? I'm on my back. So I get up and I'm like trying to get through it, and I'm like, okay, thank God this was rehearsal, because imagine if everybody's family was there, or all their friends and all the professors and everything like that would have seen me. I would have been dead. But quick story before I go jump into that. I went to go do a makeup test today, and one of the other nicer professors, she turned around and she looked at me. She goes, "Oh, that was you, right? You're the one that fell."
A month later.
A month later. "Oh, are you all right? Yeah, you were the one that, yeah." And I was like, how so word probably got around, right? Because they saw me, and then our chair was on Zoom at that time, and she must have saw it, and then everybody else in the auditorium saw it. So I had to get up quickly, got to my seat, and I
did like a back roll.
I did. I was like,
your legs were up in the air,
and then I had to like do a backwards on that, just because the space was tight, and I'm not a small individual, so it was tight. So I had to get up. I had to like brush through it, because I was just like, because I wasn't gonna cry, because I was like, I'm not gonna cry because I'm not in pain yet. And then I'm going to be like, we still have a rehearsal to do. We still have to get the ceremony done. So I was like, I'm going to go take my seat, sit my fat ass down. Ceremony was amazing. This girl over here got a freaking scholarship. Yes!
Oh, Stef.
Okay, like, you are going to be amazed, like, because you can see, like, the passion that goes into work. Like, we are very serious about our studies. We joke around, we mess around, but like when we work, we work. And this girl over here has worked so hard to keep her GPA. And I knew there was haters there, because haters gonna hate, haters gonna hate. But it was a surprise to her, obviously. I knew about it though.
You did?
I did. I did. I had to keep it a secret. I knew, because Darcy and I were talking afterwards. Like before all this shit happened, she was telling me about it. Because we have
what?
Yeah, I knew about it. But I'm gonna keep it secret. I knew about the scholarship. I did. Before you. I did. I knew you were gonna get awarded.
Well, you knew about the scholarship, but you didn't know who it was going.
I knew one of them was you. I knew one of them was you. I didn't know who the other one was, but I knew one of them was you. So I had a little sneak peek about that. I was like,
wait, how long before?
Like maybe 2 or 3 hours before. Like, not even. She was like, don't say anything. I was like, I promise I won't.
And she did it.
I did it.
Oh, just now.
Just right now. And then I got injured. So it was a great ceremony. We had great speakers. Some not so great, but you know.
Mm-hmm. Could have been last minute.
Could have been.
Preparation.
Could have been. But that's the difference when you have Anyways, yeah.
So a new little tidbit that we're doing, since we're so involved.
Because we are.
We're gonna be running for certain positions in the government.
Shots fired.
So I will be running for president, and she'll be running for VP, and today we're gonna be a power couple.
What? Okay. Here's the thing. I originally wanted to run for another position, and
that doesn't exist because this school is very limiting in general. Anyway, continue. Sorry.
So Ariana was like, Stef, why don't you just run for VP, get your blurb together, and it'll be fun. And I was like, okay. I literally told her, I said, you tell me what position you want me to run. And I literally said this. I said, any position I'm in, I will help in either way. That's what I said. Okay, so pick VP. I was like, okay. So we worked our blurb over the weekend. We dropped bombs, and hopefully we can do something from that. But as if we don't have enough things.
Yeah, my grandma said, you
do too much,
You
right?
don't have enough time. Yeah, she literally was like, you literally do too much. And she just walked away. I was like, right.
Mic drop.
I'm like involved in so much stuff. I feel like I can't sit and do nothing. I feel like, you know,
But what do
it's
you?
hard to tell you.
But when you mean when you sit and do nothing, like even if you sit and you're quiet, you're not doing any. You're still doing something, even if you're sitting and you're quiet.
I can be sitting in my quiet as president.
Yo, I fucking hate you. But I fucking hate you. But no, but in a sense, it's like we're. It all goes back to us wanting to be involved, going back to doing the outreach program, and then that's another thing we're going to talk about. Trying to get in part of student government. We've done volunteer work. Ariana did Halloween trunk like trunk or treat at a children's hospital. Like these are the things like that's fun to us. Like it's fun for us, and she's super involved with her church. So it's just like why not do something to kind of implement. Like this is the point of the podcast too. Is kind of like to being set an example. Like you can do so much more as a nursing student, as an individual, as a complete. This is what we want to treat you in nursing, right? You are a whole person. We also had this great presentation this week, and we were asked to be speakers at the medical outreach. Now, I remember in our first or second episode, we talked about our program and that we were being involved with a art show with the organization Love Without Borders. So this past weekend, we had the art show, the pop-up art show, and it was fun, but it was an eye opener. A lot of other things. Yes. But we had the extreme honor to be speakers, and I had presented a short film, and Andres and I we worked on it for 3 days, trying to make sure that
it was phenomenal.
Oh, thank you.
Absolutely phenomenal.
And it's like
professionally made.
Thank you. And like it's getting a buzz around the school, and I'm nervous about it because like I'm trying to do student government, and now all the professors are coming to me. Oh, Stephanie, I saw this video. I said, what video? And it wasn't me trying to be dumb. It was just like I didn't put two and two together for them to say, oh yeah, I heard about this video that you made. I want to see it. And I was like, okay. I'm like, she's like, share it with me. And one of our pharmacology professor, she was like really like talking about, we need to find a position for you. Like this is something that we can really use to promote the school and highlight the health sciences and how great the program is. And I was just like, like it's a lot of pressure, but it's like it's nice to be recognized. Yeah. You know what I mean? So it's like a lot of hard work went into that.
We can graduate and then you become faculty.
Who knows?
That could be something that you do, like you're a multimedia
coordinator. Yeah.
And then
so
that'll be cool.
That was something like I was taken back by that. I was like, oh, okay. But because life is lifing and we are just like so accomplished individuals, we can't help but be more involved because look at all the great things that are happening, man. Yeah. So it's just like we want to
change a thing.
Yeah. Why we want to encourage you to do the same, like be more involved, do things that make you happy, do things sometimes you got to do things that don't make you happy, and one of them is walking into a patient's room and saying hi.
Yeah.
But it's part of it. But
and wiping a butt is not as bad as everyone says it
I
is.
mean, I've wiped a few butts in my time. It's not that terrible.
It's really not. Put a mask on so no one sees you making faces, and wipe the butt.
Good pushing.
Yeah. That's it. Nursing assistants do it every single day. They're desensitized to it. You can be too.
But I think with everything that's been going on, we still have put our focus into our studies, and we are trying to do our best to be not just passing. I hate the word just passing, and I hate but that's what I'm doing.
No.
That's what I'm doing. I'm just passing.
No, you're not.
In my head.
To our standards.
To our to our standards, I'm just passing, but I'm taking a breather, and I feel more successful in this semester than I've had in my previous nursing, you know, goals, you know.
I do have to say, just speaking on the school, yes, there's a lot of like things that aren't available, things you
Yes.
wouldn't see at other schools that we don't have access to.
Yes.
But none of the faculty here ever tells us no.
I yes. I have to agree. I have to agree.
They just say, go ahead.
Go ahead. Yeah.
I'll
Yeah.
help you. Go ahead.
Yeah.
And that I
That I have to
admire.
agree. That I have to agree.
That I think that's why we're so successful. Is no one's getting in, like no one's stopping us from.
Oh, bullshit. One of the professors to
What do you mean?
Okay, bullshit. I took and it was a good she had a good reason why she said no, but all right.
Oh.
So we were trying to go over our cranial nerves, right? So we 1 through 12, where we at? We're talking about the hypoglossal tongue, right? So no, 5. 5 for gag reflex.
Oh,
I know if y'all listening and
don't hold us to it.
don't hold us to it because we just learned it today.
Mhm.
So we're trying to figure out the gag reflex. So I was like, oh, can somebody put like a swab down my throat to see? You know, I said, we'll pretend we'll do a strepto test. And she's like, no, we're not testing your gag reflex like that. I was like, she said no to me. So I was like, okay, that was just one example.
Oh.
That was just one
I
example.
think she's right in that.
That's what I said. That's why I opened it up and I said, yeah, she was kind of right about that.
Some people are going to get some messed up throats based off of how we saw people giving CPR.
I fucking knew you were gonna say something about that. I fucking knew it. All right. Okay.
Are you gonna talk about
we are. The fuck we are. Okay. When we are doing CPR, just like anything else, everything is in order, right? There's an order because we're still learning. It's a skill. And when you practice a skill, you do it over and over and over again. There's an order to it. I was very concerned with things being out of order. And technique, I can't stress enough. People have different techniques for different things, but are still the goal is still being accomplished.
Still, yeah.
Right? Am I saying
They're
that right?
completing the action.
I'm completing the action. See?
And this was a requirement?
This was a requirement to get in, right? One of the things. One of them. I'm going to make sure that I am not in a position where I'm going to need CPR anytime soon.
Or the use of an AED.
Shit, the way I fucking fell in the white coat ceremony, you would think a bitch would need fucking CPR. Fucking legs up here like this, not moving, quiet. She needs CPR. Where's the AED? Fucking, oh my God. But yeah. And I think it's because, again, it's our standards. And there's
I don't think it's our standards. I'm sorry.
You don't think so? No. Okay.
Only because this was a requirement to get into the program. And on top of that, it wasn't like you completed it online or anything.
No.
You had to go to a 4-hour course.
Yep.
What were you doing in those 4 hours that you can't get it right now?
The thing is like, I guess it's different when you have to apply the skill. It's different. Like, it goes back to like at the time of COVID where we had a lot of people that were learning over the computer and certain skills were, done over the computer and it's not applicable. You know what I'm saying? So I guess like, I don't know if this was something like you learn virtually, it's not the same. It's not the same, So I felt that I kind of walked out.
She left.
I fucking left.
And she leaves a lot. Like but the way she left in this moment, I was like, oh, she big mad. She mad. Because it was baffling.
Yeah.
I was like, I stayed, but I was speechless. I hope they get it though.
Yeah. And that's the hope, The hope is that we're all still learning. It's something that's important,
Mm.
and it's one of the requirements. Ariana keeps saying it's a requirement.
It's a requirement.
It is a requirement.
Yeah.
So don't be afraid to say, yo, I need help, or hey, maybe this is not right. Maybe there's a way that I can correct it or address it, But
Mm-hmm.
I I was annoyed that day.
Mm-hmm.
I was annoyed that day. And I'm like usually chill.
Yeah, but we were tired, exhausted.
Yeah,
We were over
we
it.
were over it
My
too.
social battery was bottoming out.
Yeah. Yeah. So a lot of it took into consideration for that action. But
Mm-hmm.
yeah.
Mm-hmm.
Anywho.
Anywho,
Anywho.
so that's what's been going on like the past 4 or 5 weeks. There's a lot that's happened, but we're here. We're still standing. We're wobbly, but we're still standing. Steph is is back and better than ever.
Bro, if you saw the injury that I sustained, I went to the hospital the following day. I ended up getting whiplash, and I ended up getting I had bruising on bilateral sides from my shoulder. So
Mm-hmm.
from my shoulders all the way to my elbow, because I was in between the chair. So when I went back on the chair, the metal bars, I got bruised from the chair.
Yeah, like raked her.
Like, yeah. And then my legs were hurting me. Then my chest was hurting me. So I had to go get Dopplers. I had to get rule out of PE. I had to go get, it's just, it was a shit show. And then I was on muscle relaxants because now I'm in the process of like getting,
And we had a test right when you had to start the
oh my God, I had a farm exam. And then it was just like, it was just, it was just a lot.
Mm-hmm.
It was a lot.
Yeah.
You know, I'm not, I'm not, I'm back, but I don't know if I'm better than ever, but I am back. I'm functioning. I'm functioning. But yeah, that's life. Nursing school, life. Life is lifing. But what we want to talk to you today is a bunch of things, and we want to get back to the basics. And CPR is one of those basics. You got to go back to the drawing board. If you're not comfortable, you need to go back to the drawing board. I can't emphasize that more enough, because if you are called upon and you graduate and you are called upon to do that, you are expected to perform. You're expected to know what your ratio is. It's 30 to 2. You have 30 what to this. You have to know your compressions. You need to know your timing. You need to know whether or not, if it's a 2-person team, you need to know whether, if it's a pediatric, am I going to go ahead and perform 15 twos? Like, people that have to understand that ratio, you have to understand that, and it's very scary. You have to lock your elbows. You have to be able to know the positioning.
Mm-hmm.
Where is your point of compressions? Where is the point of that, right? So we're looking at, what point are we looking at, right? So we have your sternum notch, right? Going down more further, you're going down to the xiphoid process. You don't want to go too far down, because why? You don't want to be cracking ribs. You don't want to be cracking. So you're in the sternum, in that area.
2 inches in.
2 inches
with
in,
every push.
right? With every push, right? So now what's your rate? Your rate is what? 100, right? Beats per hour, right? So what's the time? Ha, 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 staying alive, staying alive. And we were singing in the fucking lab. And that's why I was getting upset. Why are we singing? It's like, really?
Maybe it was you. Maybe your song was off. Yeah.
It could have been. Could have been. But yeah.
Highly doubt it, but
Highly doubt it, but yeah. But again, when we talk about the basics is just, it's important. It's important. I can't stress it. I can't stress it. And I want to talk about, clinically speaking, the art of the interview.
mm-hmm.
And what you want to do first is you want to recognize your cues, right? Now, both visual and verbal. So there's a thing that we use in the setting is called old cart. So does anybody know what old cart is?
No?
No.
Okay, let us tell you.
Let us tell you.
The old cart is how you handle somebody's complaint. Somebody says they have stomach pain. this is how you go about it. So you'd ask them their onset, their location, duration, characteristics, aggravating factors, what they do to relieve it, and then time.
So you have O, which is onset, L for location, D for duration, C characteristics, A aggravating factors, R what relieves it, and T time.
Mhm.
Super important, and it's orders, step orders. It just makes life easier for you.
Yeah, so um, the other parts of the nursing process that you'll apply this assessment into later, it's also broken down into recognizing your cues, gathering your cues, analyzing them and prioritizing a hypothesis, generating your solutions, taking your actions, and then finally evaluating your outcomes. So when you're recognizing your cues, you're recognizing both your old cart, their vitals, um, their health status, um, any type of visual thing that you can, any inspecting that you've done without even speaking with the patient. Then speaking with the patient, any type of palpation, percussion, auscultation that you did, you're going to gather all of that into the next step and see what groups you can place them in so that you can create a hypothesis of what you think is going on with the patient.
Or what could be going on with the
Mm-hmm.
patient.
So, actual versus potential
Potential.
problems.
Mm-hmm.
Then, afterwards, you're going to take your action, which is whatever you're doing to treat the the issue that you create a hypothesis around. So then you take your action, like giving medication, and your evaluated outcome is what was the goal of you giving that medication? It's so that they can decrease their pain from an 8 to a 6.
And was it successful?
Mm-hmm.
Right. And then that's when we come in, we have to reevaluate.
Mm-hmm.
Was the medication that we give successful? How do you know that it was successful? This person had an O2 of 90, now it is 96. Those are the things you have to keep constantly reassess, but you have to keep an eye on everything altogether when you're gathering your cues. And things are both objective and subjective, objective, excuse me, and subjective. So, what is subjective? What is subjective data?
So, subjective data is when you are asking the patient what's wrong. Anything that they say is their subjective data, it's according to them. So then you take their subjective data and you create it to be objective. So you take a vital sign that may correlate with the symptoms that they're speaking about. They feel like their heart is racing, they're having palpitations. You take their heart rate. You apply objective data to their subjective complaint. So, with that, that's another cue that you're doing.
Yep.
You do that in a focused assessment, an urgent, emergency, comprehensive
Comprehensive. Yep.
assessment,
Yep.
all of which we'll talk later on, maybe today or in a
Or
different
in a different
episode.
episode, for sure, for sure.
Um, but all of that goes into how you're going to treat the matter at hand. If it's a comprehensive and the patient is stable, they still have issues that they're being treated for in the hospital. So we have to continuously be doing this clinical judgment. It's constantly in movement, and it's not like this. It's not like one through 1, 2, 3, 4, 5. It's overlapping each other
Mm-hmm.
because you could be applying a clinical judgment of one issue while starting a new one. So,
Yeah, and that, now imagine doing that for multiple patients
mhm,
simultaneously.
mhm,
So not only do you have to learn about time management, you have to be able to do the work, be able to take your actions and do your evaluations all simultaneously while you have to be looking at other patients. So time management is it that's a skill in itself,
yeah. Mhm.
So
And like we in our clinical, we get to clinical around when the shift switches,
the change of the
and
guards. Yeah.
yep, and it's time for meds around 9 o'clock, 10 o'clock, and so is rounds. So around 10 o'clock is when all the meds are due, and you could see the nurse will start on her patients, and by 12 or not 10 o'clock, maybe let's say 8:30.
8:30. Yeah,
They
yeah, yeah.
start at 8:30, and they have 5 patients, and they could be on their second patient, and it's almost 10 o'clock.
Almost 10 o'clock. Girl. Girl.
And I'm like, and I'm looking
And
at
she
them, and I'm like, That's okay.
Like
You can do that.
and it's not like they're dilly dallying either.
No, it's
They're
like
not. They're
they
not.
got caught up.
Yes. They're not on their phone and shit. They're
Mhm.
like,
Yeah,
this is real life.
yeah. Because on top of that, when they go into patient one hasn't gotten a bed bath. Patient one just went to the bathroom. Patient one didn't have a bedpan. Patient one is sitting in their own excretions and need to be cleaned up, and the nursing assistant that's on the floor is busy.
Yep.
You have to clean that patient. That is your duty
That
as
is
a
your duty.
nurse.
Yep.
You don't give that duty to somebody else. No pun intended.
Nope. You said it twice. That's why I laughed the second time. You said duty, and I was like, she's gonna say it again. She's gonna say it again. She's gonna say it again. Sorry, I didn't mean to interrupt your flow because you were doing so
take care
good.
of that doo-doo.
That's it. That's on you.
So, yeah, as a job, like when you are learning the foundations, you have to learn from the bottom. In the event that the people that are there to assist you, such as a nursing assistant, if they're not there, you need to be able to do it yourself.
Absolutely. You
There's a lot of nurses
you
that
can't
don't
just
do
rely
that.
on them. No.
Yeah.
They're busy themselves.
Mhm.
I mean, they're not dilly dallying either.
No.
No, it's hard. It's hard to be able to have that balancing act. And I think nursing school, I kind of think it teaches you that because you have to be able to balance 4 or 5 classes. You have to be able to balance, kind of manipulate. Okay, I'm going to study this amount of hours for this class. I'm going to, there's a different method of studying for this different class. But time management is one thing, but it's just like once you out there, like that shit goes out the window.
Yep. Yep.
But in terms of just the nursing process, like trying to be able to just kind of remind yourself, like you are only but one person. Yes, there is a lot of expectations placed on you because you are the RN. You have a license. You have a lot of I don't know if pressure is the right word, but you have a lot of responsibilities. Yeah.
Mhm.
And it's hard to place that on one individual, but you have to work in a team. And that's another fucking thing.
Yep.
It's one thing to work by yourself, but you have to be
Work
a
as a
team player.
team. You need to
Yeah.
like when you're changing shifts and they're doing rounds, you need to be there and inspecting the patient while they're giving you information because you need to know what the patient's baseline is. If the patient is not entirely oriented, you need to know if they're not usually oriented.
Right.
So there's a lot of things that go into this, and it seems scary, but it'll just come like this. It'll come second nature.
But that comes with practice, though.
Mm-hmm.
Like you have to practice, just like anything else, like a particular skill, interviewing, nursing process. It takes practice. It does. And and I guess the advantage that we've had is because we have worked in the field before and we worked in medical offices and stuff like that. We have a slight advantage, but it still doesn't change the fact that it's still hard. It's still hard. So being able to do that balance act is not it's not easy.
And also, if you make a mistake as a brand new RN, I'm I'm sure it's going to be okay because they're understanding what the knowledge of what you're coming in with. Okay? Like 2 weeks ago we had clinical. I think you were with a patient. There was a new RN that joined the floor. She had to have been around my age and she was crying.
Oh,
I don't know
poor.
if you saw that.
No, I didn't.
She was crying because she almost overdosed a patient. But it wasn't it was like it wasn't like a crazy med.
Not insulin, nothing like that, right?
No,
No.
it
Okay.
was like I don't know exactly what med it was, but it wasn't like an opioid or anything like
Okay.
that.
Okay.
But she almost gave it to him after he was just given it. Something like that.
Ooh.
And she was crying. She thought she was going to lose her license, all of that. And the nurses on the floor supported her. They pulled her to the side. They were like, "Calm down. Nothing bad is going to happen. You know, just clean yourself up. We're going to go see the patient. We're going to take care of everything." And then she just went about her day. She was okay.
That's hard though.
Yeah.
Look
I saw her this week.
You did?
Yeah, and she was fine.
Oh my god! But look how hard we are on ourselves just in our studies. Just imagine us how hard we're gonna be on ourselves in the field. Why you got your? I'm telling you.
I'm going to get a one-way ticket somewhere.
Yes.
If that happens.
There's no turning back. No round trip in this escapade. But that's the thing. I think like we have to, like when we think about how important it is to understand our role and our scope of knowledge, right? I think when we have our scope of practice, there's so many entities that kind of dictate what we are allowed to do, what we are not allowed to do, what are some of the factors that take into consideration to saying, you know, um we're not diagnosing, right? That's one thing. We don't diagnose, right?
Yeah.
So that is a doctor's that's within his scope of practice, right? So but what we have is what they call nursing diagnosis. Now, I personally haven't seen any of that.
They did away with that.
That's what I'm saying. So but again, that's just our school. There
Mhm.
might be other schools that really focus on a nursing diagnosis and see, breaking down the hypotenuse and breaking down the actions and evaluations in that care plan, right? So when you go to the field like us, like we're going to a computer, you're literally looking at a care plan because they need to have what medical background, health history. They need to have an extensive write up of they document freaking everything. So it's like you're looking at a care plan from beginning to end, but the nuances in every different EMRs isn't like an electrical medical record. There's different computers and different softwares that kind of show you, all right, this patient, like what was the program we're on? Are we on Epic?
We are on Epic.
We're on Epic, right?
Mhm.
So Epic is different from another software from e-clinicals and stuff like that. So it's just a matter of like kind of figuring out what type of software it is, but all the information is there, but you got to sit down and read it.
Yep.
And that takes time.
Yep.
So that's why when the nurse is giving medicine at freaking 8:30, she's probably reading the fucking chart. And it's probably taking her forever because why? She's trying to get a baseline. She's trying to understand if there's any medical history.
And on every
any
shift
allergies.
change, you have to do a head to toe.
You have to do a head to toe.
How are you doing
How?
all of that?
I don't know.
All of that.
I don't know. Did we just, are we in the wrong career path? Yo, I don't know.
I think we just blew our own minds.
I think we did. I think we just convinced ourselves not to go into nursing.
We're gonna wrap up this
We
semester.
can wrap up this semester.
Oh my god.
What you said? What ticket?
I'm gonna get a one-way ticket somewhere. Oh my god.
I think we just we put our foot in our mouth.
Oh boy.
Oh boy. Yeah. How do we follow up with that? Do you still want to do this?
Do they still want to do this? Forget about me. We just scare everyone away.
I think I scared myself off.
You see all the subscriber go down.
Okay. No. Okay. Here we go. Here's the thing, right? Let's go back to what we were talking about, right? So, clinically speaking, we're in the clinical setting, right? The art of the interview, right? What did Ariana say was the scariest thing was going in and talking to the patient? All right, take it from there, Ariana.
Okay. All right. So, what you're supposed to do, this is what we were taught, is that you're going to practice hand hygiene. Okay?
Hand hygiene.
Hand hygiene. You're going to get your clinical assignment. The way our clinical is handled is that we are given a specific patient and the corresponding nurse. You go to the nurse, you get report, and then you go and wash your hands, and you enter the room, and it's go time.
Go time.
Okay? So you're going to say, hi, my name is Ariana. I am a student nurse, and I just came to speak with you a little bit about what's going on, what brings you here. And more often than not, they're not going to be happy to see you because the hospital shares clinicals with every other nursing program nearby, and they probably would just asked this last night, during the day, the day before. So
you're already coming in as a negative.
You're already defeated.
You're already defeated.
So, while you're in the room, you're supposed to be inspecting all your surroundings. Okay, you're supposed to see if there's any dangers for yourself, for the patient. You're looking to see, is the bed rails brought up properly? Are they restraining the patient for some reason? Um, you're looking at the bed height. You're looking at the patient's color. Are they blue? Are they do they have, what is it, pallor? Do they have pallor?
Pallor
I don't
is
know how to say that. Do they look pale, basically?
yeah.
Um, what's their oxygen? You're looking at all their vitals. So their vitals are going to be your temperature, your pulse ox, your BP, your pulse rate, and your respirations. Respirations are important. They're supposed to be between 12 and 20.
20 and 20, yeah.
You see that patient has like about 24. You're going to be a little curious about that. Yes, it's only 4 extra over the range, but that matters.
That matters.
Um, and they could be,
Because it's a slight change.
it's a slight change, but they could be, they could be in distress for some reason. So next is, we'll just go down the list. BP. Your BP is your blood pressure. It should be around 120 over 80. That is
A perfect number in the
oh,
perfect world.
yep.
Right.
But everybody's different.
Everybody's different.
So I usually am on the money. I am 121 over 82.
Show off.
That's how the automatic. But by the way, fun fact: automatics can do odd number readings.
Yes.
And manuals only do even
Even.
number readings. So if you're doing a manual and you get an odd number reading, you better do it again.
Do it again.
Anyways,
Anyway,
your heart rate should be between 60 and 100.
100. Yep.
Okay. And
For an adult.
for an adult.
Well, adult. Pediatrics is different. It's a little bit higher. But yeah.
And then infants, it's like really high.
Really high.
And then what else? Oh, pulse ox. It should be 95 to 100. That should be a normal range. But given the circumstance of your patient, let's say they have some type of COPD or emphysema, they're going to have a lower oxygen saturation, and that's going to be normal for them.
Right. So what is COPD, right? So C is chronic, O is obstructive, P is pulmonary, D disease. So with that disease in particular, carbon monoxide, not carbon monoxide, carbon dioxide. Monoxide is not good either, but carbon dioxide has a tendency to stay within the patient. So for them, on room air meaning your surrounding, environment. The patient's not on any oxygen that's connected to the wall, nasal cannula, which is, a tubing that goes in between the nose. Patients there on room air at 92 and they're a COPD patient, that's pretty normal.
Yep.
But if you didn't know that and you see a patient like,
oh crap.
Like, so
are you okay?
Yeah. So these are the things like it's important for you to recognize that and understand that this might be typical baseline for them. So
yep. And then lastly is temperature. Temperature can range between 97 to 99. That's a normal range. Once it starts approaching 99.6 ish, it's like you have a slight fever. But some people run a little higher than others.
Yeah.
In the next episode, we're gonna discuss different temperature areas that the different areas you can take a temperature and the variations between the locations. But usually a temperature in the hospital is taken sublingually.
Sublingual, yeah. Yeah, we're not gonna talk about the other places I've taken temperatures at. So moving on. Especially in the hospital setting.
And you're doing all of that once you walk in. Before you even, like, as you're saying, hi, my name is, you've done all of that. You've noticed everything you've needed to notice first, and then you can start your assessment questions.
Yeah.
Why you start your alert and oriented questions.
Which is part of neurology, right? So that's your neurological testing and assessment in that. To go back what Ariana was talking about before you even, like, as soon as you're walking into the room, you're looking to see if that patient's IV bag is hanging. You're looking to see if there's any tangling, which is a safety issue, right? If the patient's restraint, how long have they been restrained? Was there an order for that restraint? When was the last time was this checked? We're looking for wounds. If we're looking for anything for that. So you're not even touching the patient yet. and you've already done 1,000,001 things already.
Yeah. It's like a rapid assessment. Crazy.
It's crazy.
So yeah, what was I saying?
You were talking about your assessment, your questions for neurological.
Oh yes. So you're gonna start with A and O questions, alert and oriented. So you're gonna ask their name, their date of birth, what brings them to the hospital, do you know where you are, and do you know what the date is? And the last one is the most advanced, the most complex question for them to answer, and it should be more specific. Should be the date. It should be the day and what date it is. If they just say the year, um, it's you know
Eh.
there's a question to if they really are oriented or not. But after that, then you can start. Okay, what's wrong? Why you here? What happened? Oh, can you tell me about how long you had that for? Um, you're going through old cart now at that point.
Now remember, what was old cart? Do you remember?
Onset,
Onset,
location,
location,
duration,
heuristics,
characteristics,
aggregation of
aggravating,
factors,
re- relieving
right?
factors.
Time.
Yes,
Right.
yes, exactly. So, after you go through that, then you're going to ask them about their social history. Do you smoke? Do you drink alcohol? Do you participate in any substances? Have you ever abused any substances? Who do you live with? Do you live in a house with stairs? Do you have to, is your bedroom on the second floor? Things like that.
You live by yourself. Who do you
Mm-hmm.
live with? Is there anybody that's here that's visiting you at the hospital? Is there anybody that's helping you home? How did you get here? Do you live, with your partner? We're, it's like 50 questions.
Yeah.
Like, let's say if you're, as Ariana mentioned before, if you're alert and orientated 0, which we were in the beginning of
Can't
this,
really go through any of
you
those
can't go
questions.
through any of that.
You have to operate strictly off the chart. And if you better cross your fingers, you better cross your fingers and your toes that they have been going to a doctor's office that uses the same EMR.
Oh, we're not even going to talk about that.
Because
No,
if
we
they
are.
don't,
We are.
I don't even know how they do it. Because you,
Yes.
yeah,
Yeah.
yeah,
Because now, if there's information, if the patient can't communicate themselves and can't even communicate to you their name, their date of birth, how in the world are you going to be able to understand what
mm-hmm.
their issue may be and help them with it?
Yeah,
It's so difficult.
mm-hmm.
So it's
Yeah.
hard.
So I'll give an example. We Steph and I shared a patient on the first day. She was Spanish speaking, so Steph speaks Spanish fluently. She was able to have a conversation with this woman. And we learned through our assessment that she has very high blood pressure.
Very high.
It was like what, 160,
It was like
170,
yes,
over 100.
over
And
100.
I was like, Steph, that's not good.
Yeah, and we thought that we were taking the blood pressure wrong, and we did manual.
Mm-hmm.
We were like
We did 3 times
three
on each
times.
arm.
3 times. And I'm like, damn it, I know how to take a blood pressure. These numbers are still high.
I was like, Steph.
And I'm like, is this we're doing this shit wrong. And that's the thing.
Mm-hmm.
Nursing school will test you because you think you have a skill down and then you're looking at the numbers, but then we were fine. Like we were right, but it was just like it makes you doubt yourself.
Yeah, yeah. So now, through speaking with her, and we're like, your blood pressure is high. You take anything? And she was like, I take something, but I don't remember this and that. And her daughter ended up coming later with the baggie of the blood pressure medication. And I was like, Steph, ask her why she's not taking it.
So she said that she doesn't take the American blood pressure. She took one from her hometown from El
Yep.
Salvador.
Mm-hmm.
So she takes that particular medication. So I took a look at it and I'm like,
It wasn't even in the chart.
it wasn't even in the
That
chart.
she was taking it, and she's not taking it while she's in the hospital. But she wasn't being medicated.
She wasn't
for
being
it
made
in the hospital.
exactly. So when we
So
like what
So now here's where I was baffled then. I was baffled 3 days ago. I was going with my nurse, going through all the meds, and she told me to do all the blood pressures for everybody.
Okay.
I did a blood pressure for someone 160 over 100. She goes in the chart and she looks and she goes, "Oh, okay, yeah, that's fine. It's his baseline."
What? What? I didn't know that.
I said,
Is it not being addressed?
"Are you sure?" I said, "You want me to do it on the other arm?" She goes, "No, no, that's okay. It's his baseline." I was like, "What? What happened to 120 over 80?"
It's in the textbook. That don't mean it's in the real life.
I was like, I'm flipping the pages here and I don't see what you're saying.
Oh my God.
Yeah.
That's crazy though.
So you're gonna come across things in clinical where it's like totally goes against everything that you've learned, and
Absolutely.
somehow it's normal and it's okay, and the patient's still living and breathing, and will go home with his blood pressure being 160 over 100 because that's his baseline. What?
No.
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 So, mm-hmm.
So it's so important to get your full history because
Mm-hmm.
and the thing is I think like when you mentioned before like when the nurses are doing their rounds it's so important for once you have that exchange that when you're changing your shift you got to talk to the nurse but you got to go find out the information for yourself because sometimes people might not be reliable. I mean it's not in a sense of like because they're not. It's just like maybe there was information that was missed or whatever. You got to check for yourself. You got to be able to go back in there and was like, all right, let me go check what's going on. Let me verify with everything like that. And everything you have to document.
Yeah, everything.
Everything.
Plus, another thing is that when you're coming right when the shift has changed and the nurse hasn't yet given the meds to introduce herself to the patient, she doesn't really know like anything but the summary
The
of what she
summary.
was given.
Yeah. Yeah.
So you got to go in the chart and you got to look at everything and make sure you know what you're talking about, before, after, during going to see the patient.
Yeah.
And never answer anything. The
Never.
patient asks you what's happening today, you don't know.
You don't know. You don't answer.
You don't know anything. You were never there.
You were never there. Precisely.
I'm getting a procedure today. I don't know.
I don't know. I'm not sure.
I'll have to ask.
I have to ask. I have to follow up with you. If they
Mhm.
have any information, I will try to get back that
Mhm.
information to you as soon as I can. That's it. We're going to save you.
We're your angels.
We're here. And it's hard. We ain't it's hard. But we're going to learn and grow and do
And therapeutic communication is like key.
on the nose.
You can't if you are unapproachable and you walk into the room and you are basically feel like you're badgering the patient. The patient's not going to tell you anything.
They're not.
You have to come, soft spoken. Well, not entirely soft spoken like me. A lot of people can't hear me. But like, you come in like a kind manner. You come with, they can feel the empathy oozing out of you, you know?
Right.
And they'll be more prone to tell you about, their home situation. Yes, I am homeless, things like that. And, you know, that's how you become a better nurse. You practice it now and you'll be able to do it really, easily. It'll come second nature to be like that when you're at your job.
And that's and it all goes in part into that art of the interview. If you're able to get a good amount of information while doing your assessment, while doing everything at the same time and multitasking, not only are you going to be able to get all the information you need in order for you to complete your day and understand the patient, now you're able to have the patient trust you. That's the I think that's really the goal, right? It's not to have the patient trust you, have them,
You're their
speak to
advocate.
you're
You
there.
are.
Absolutely.
Anything that happens in the hospital and somebody needs a question answered, you're the point person.
You are.
So not only do you have to know the situation, you need to be there for the patient. Be their person.
Be their person. And that's hard. And that's hard because you I forgot what's the term that they have. It's like when you have too much empathy and you like the term. It's gonna come to me. Fatigue? Is it empathy fatigue?
Oh, I don't know.
It's like a term that like if you like you've been giving so much of yourself and you're actually like fatigue from giving too much of it.
You feel so much from so many people.
Yeah. It's a lot. And I think
I'm not sure what the
and
fuck
I think
that is.
psychologists
Mm-hmm.
go through that. Um
Yeah.
like it's
Yeah.
because they're kind of like
You're constantly giving yourself.
giving yourself.
Yeah.
And it's like it's a term for I'm gonna kick
Mm-hmm.
myself. I can't find the word, but it's a term that you're fatigued, like you're from doing so much. But I think that's what makes nurses so special. That's it. It takes a special person to be a nurse. It takes a special person to be a doctor because it takes a lot from you. You have to give, and you have to be willing to give. That's what we're here. Give you all we can
Yep.
in the process.
Even when we're disheveled.
Disheveled. But I
Mm-hmm.
want to go back to therapeutic communication. Like, there's different types of therapeutic communication, and I think one of them that's the most important is actively listening.
Mm-hmm.
It's one thing to come into a room, like you're already introducing yourself and you're trying to get a history from your patient, but are you really listening to what the patient is telling you?
Yeah.
Right? Like you have to be genuine. like I'm literally listening to you. I want to know everything about you because that's going to make not only you feel better, but I get a sense of you.
Yeah.
That's my job.
It'll make them feel like they're wasting your time.
And that's not
Don't
what
feel good.
yeah, you don't want to do that. What's another type of like
Well, we just spoke about empathy,
we did.
but you don't want to ask them questions that are um leading. You want to be more open ended.
Right.
You don't want to try and get them to say a certain answer. You want them to just, make it a thoughtful answer for them. And then you learn about their cultural values, their religion, the type of things they do at home when they feel sick. What do they do at home? The type of herbal remedies they do and things like that.
Like if they're taking anything, what's their
Hmm.
favorite food? What is
Yeah,
their diet at home? You,
yeah,
no, are you a high sodium kind of person? Are you like
yeah.
you in stuffing in the bread?
Hmm.
What's the word? Big back in it.
Big bag,
Big
big bag.
bag. But you learn so much from just from that type of communication. I think that just coincides with everything else, like the open-ended questions, actively listening, being
Hmm.
empathetic, and we're trying to like re-emphasize like how important that is. Like you're kind of summarizing whatever the patient's trying to tell you from that subjective data and objective data. We're trying to summarize that all together so that not only you and I, we are on the same page because now we understand what's going on. What's the situation? Both you and I were on the same page.
Hmm.
You know what I'm saying? So
Hmm.
that's
Yep.
always important.
Yep. So then after you do your open-ended questions, you can do focus questions. But that's after you've truly you're getting the
Yeah.
meat of it and you want to see there's something specific that they're going through or they're not. Um and then you have to summarize. After you've asked them the question, they've given you their answers, you have to summarize, okay, what did you get from what they told you? And then they'll confirm, yes, that's exactly what I said. Or no.
Or no.
And then you just fine tune it.
Right.
Yep. And then you're building rapport through all of this with your body language, like the way you're speaking to them. Um,
What
and
did you say that you had me cracking up the other day? It was like, yeah, you can't be coming in with your scrubs looking dirty and coming in with an attitude. Like
yeah,
it was
I
the
was
way
a patient.
it was the way you said it. And I was
I
just
don't know
like
what I said. I say some out of pocket stuff all the time.
I remember I'm trying to understand what was the other like what was
I
the
don't know, but I was like, if I was a patient, I wouldn't want my nurse all rumpled up with their hair all sideways,
and disheveled.
like I look now.
Yeah. Well, no.
No,
I mean, we've had a long
camera
day.
can't see it, but my hair look crazy.
No. It's been a long day.
But yeah, I want my nurse to look neat, clean, smells good, batten their eyelashes at me. Okay?
And that's where body language comes in, right?
Yes.
So you want to have come in, you're not going to be confident. Like you want to be confident because you want them to be able to trust you, that you are an individual that they can trust and they're an individual that they can depend on you. As you mentioned before, you're their advocate. So they're going to ask you questions. So if you coming in like very shy and not knowing what you're talking about and stuff like that and shoulders down and head
Mm-hmm.
down,
Yeah.
that's not a way of communicating. You have to
Yeah.
be able to, come in and,
And don't come in cocky either.
that
The
don't
complete
do that.
opposite. Don't interrupt the patient.
Don't do that.
Yeah.
Like,
That's
no,
not cool.
that's not cool. So body language is another thing. It's another way of communicating, and that's another thing you have to think about that when you're
Hmm.
entering in the patient's room. Yeah, for sure.
So with asking them questions and learning about their culture and things like that, you'll find out and see how their body language is towards you. So some cultures they don't feel comfortable with strong eye contact. In American, in America, we like to give other people eye contact.
Yeah,
It's like, it's a sign of respect
respect.
that
Yep,
we're listening. But in some other cultures, it's the complete opposite. And then on top of that, hand gestures. If you're making, the okay sign or the thumbs up, certain cultures aren't accepting of that and they feel offended.
they feel offended. Yep.
So you have to kind of like gauge, um, how the patient will be receptive towards, you know, your mannerisms.
And I think that's too, like, that's why it's so important, like, when in our studies that we have cultural competency. So meaning that you don't have to be an expert in every culture. That's not, it's impossible because there's so many diverse cultures, and there's such a diverse community that we as nurses will always be, bumping into. But being able to understand in the cues, understanding that everybody is different,
Hmm.
and being able to kind of use that as a understanding that culture is plays a part in their hospital stay.
Yeah.
They might not like the food that's there. They might have an allergy. They might have religious reasons for not eating certain things. People might not eat that pork,
Hmm.
you know. So being able to read the patient's body language along with ours and understanding that their culture does play a part in their hospital stay. It's just so important.
Yeah. Um, and that really pretty much sums it up.
Yeah,
We've
yeah.
covered, you know, you have to come in with, a sense of empathy. Don't interrupt the patient.
Mm.
Ask them open ended questions. Get a feel for who they are as a person, what they believe in, the things that they enjoy. And it is going to take time out of your day. But your day is not going to constantly be busy. There's going to be, lulls. You have time for it. You know? But this is all super important. And even not just for patients, just for human beings in general.
Yes.
I feel like everybody needs to have more therapeutic communication. We need more therapeutic communication. We be walking in like gangbusters. And we really, I think I should work on it more. I already have a lot of empathy, but I think I can have a little bit more. Um, but I try to help everybody. When I see someone who can benefit from, something that I know, and vice versa. I want to help everybody, um, build up into the best versions of themselves. I want to get to know, my peers and everything like that. So you should practice it on your classmates, not just your patients.
Not just
You
your patient.
practice it on everybody because it's a good way of being. So, you have to be a good human being.
Overall.
Mhm.
Overall. And I think another part of communication is nonverbal, because I think it kind of coincides with body language, but it's hard for me not to talk. But I think it's just as important to sit in the silence.
No side eyeing,
No sighing.
which I have to work on.
But no, but in a sense, like in the hospital setting and in,
Mhm.
in any conversation, if you're, in your classmates, like being able to not say anything is just as
Yep.
difficult as saying something.
Just standing there and holding their hand is very meaningful.
And you might not think it's a big deal, but it might
Yeah.
be a big deal for them. I know for me, like, I mean, I know my clinical professor, my preceptor. I know she I want Ugh. I know she keeps an eye on me. I know she does. I know she does.
Mhm.
And I do things like not for her. I do things not for her,
To notice.
not for her to notice.
Mhm.
I don't do it for a show. But like every chance, like everything that I've done, like she happens to see me or she happens to like hear me and things like that. Like me, I love to crack a joke. If I made you smile, like I had the older gentleman like a week ago. Yes, I had an older gentleman last week. 92 years old, sharp as a whip. His wife, maybe 92, 91, came and visited, but she had left for the day. We wanted to give him a bed bath. We wanted to keep him, keep him clean and whatever the case may be. And I told him, I said, listen, let me know what you need. I'm here to help you, la, 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 la. He goes, "You're the first person that came in here and just made me smile." And I was like, oh, it's like, it's
so
all
cute.
so for me, like that means a lot to me. If I made you smile, if I made you crack up, if I, anything that I've done that's done differently for your day, I'm like, you made my day. You know what I'm saying? So that's important. That's important to me. You know what I mean? So it's just like, and I think that's the reason why we are good at what we do. You know, we're
There was
just
a woman on Tuesday. Um, she what did she have? She had leg pain,
okay.
and it was unexplained. She was just having these. It was like 8 out of 10 pain
Ooh,
in her thigh, and she had it all wrapped, pulled up, and she was
contracted.
laying contracted. Yep, and
Oh,
she's laying there, and she's like, "I need you to help me pull down my leg, but don't touch me." And I was like, "Okay, I won't
okay.
touch you." So so now I'm putting on my gloves, and she's like, "Make sure you don't touch me." And I go, "Don't you worry, I'm not gonna touch you." And I'm saying it just like that, and she goes, "Okay, you're a good girl."
See, see,
So I was like, "Okay, don't
because you
worry."
met their level, you
Yeah,
matched their energy, and I
yeah.
think like if like we're big bubbly like personalities,
Mm.
but I find myself in different situations where I do have a patient that does not communicate. I do have a patient that is not able to crack a joke with me and stuff like that. So now I bring my energy down. I match my level with the energy with the patient. What do you need? Is there anything that you need from me? Let me know what you need.
The quietest I've
That's
ever heard you
yeah,
say
I
that.
know it is. I know. Cause that's you have to match the energy. And I think that's so important because that is the art of that interview. You have to be able to match the energy of your patient. If it means that you can't come in guns blazing,
Yeah.
say, "Hey, my name is this. I'm a nursing student." Da, 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 da." No.
It's like,
As
ooh.
soon as you inspect, you walk in. If your patient is sleeping, you're not fucking waking them up. Like, don't do that. There's times that my professor got mad at me. Like, she's like, "They're sleeping." No, no, no. You could tap them on the shoulder. I'm like, I'm not tapping them. It's fucking early. They probably just got to sleep or whatever. I'm gonna give them 10 minutes. I'll be back in 5. I'll go find something to do. It's I will always find something to do. I look and all right, I'll come back.
Yeah.
That's what I'm saying. So you come in as like, or if they're up and their eyes are open and they're watching TV and they're moving around, I was like, "Hey, good morning, how you doing?" You have to match the energy. Unless you have to read the body language, you know? And I think that you're able to do morning care, you're able to do all this, but that comes with practice and time. It does. And
And also, lastly, before we,
wrap up, yeah.
don't assume anything about your patient. So here's an example. Same day with the same, room as this patient I just spoke about. The other patient in the bed, she um, was telling me about how she used to be a nurse and that she was a nurse in Manhattan and she used to go to these hospitals and she had this arrangement where they paid for her housing
Oh,
and
yeah.
and for a contract and things like that.
Why don't we have that deal?
Yeah, I know.
All right.
But she's telling me about all these great things that she used to do. And I come to find out during rounds that she's homeless.
Get out of here. Wow.
Yeah.
That's crazy.
Yep. And they don't know the side of her being a nurse. So they spoke about her in a sense of her being homeless, that she was there for, you know, free treatment.
Meanwhile, the bitch probably got like fucking 2 degrees,
Yeah.
right? Just sitting on education,
Yeah.
20, 30 years plus of experience, and they don't know about that.
They don't know about that. They're taking it at face value that she's homeless, so she must be there for something.
I can't even tell you. Like, I know Professor gets mad at me sometimes because I be in there, I be talking mad long with them, but I'm getting my work done. I promise you. I'll go in.
And they said, "Steph, you take 45 minutes?"
I do. But what am I doing in that 45 minutes? I'm doing a full head to toe assessment. I am doing a bed bath and I am getting a full history in those 45 minutes. That is what I am doing because I'm doing it all at the same time. So I take forever. That's okay because when I am done, I am complete. I come back, I do another evaluation. Is there anything that they need? I'll come and I'll do vitals again. If the patient needs to be fed, if the patient needs to have a, have a bowel movement, whatever the case may be, I can come back because I know what they want. I know what they need. Because why? Because I spent the last fucking 45 minutes with them. And I don't regret it. Not at all. I know how many kids they have. I know what they used to work at. I know that they're retired. I know what their favorite hobby is. I know what language, what culture, because I asked those questions. I added into that. And I practice on my art of my interview. And it's the same thing with podcasting. I've worked on it because I love to know more about you. It's not being nosy. Because that's not what I want to make that clear.
We're not being nosy.
It's not to be nosy. It's
Yeah.
for me to genuinely, actively listen to you and genuinely like focus on you to get to know you better.
Yeah.
That's the most genuine that I will ever. It's not for me to be nosy because I'm
they're
not
in their most vulnerable state.
Absolutely.
So it would, it's a given that we would want to get to know you.
I'm cleaning your butt. I'm looking at all your
Best
private
believe
parts.
I'm gonna ask you what you like to do on a Saturday morning.
Right, you know what I'm saying? I'm seeing all your privates. I'm cleaning you up. You're like I've seen all of you.
Yep.
Why would I not want to know more about you?
Yeah.
Why would I not want that? But it's not. It's takes practice.
So that's how our first semester
That's
of
how
clinical went.
in a wrap up. In a wrap up, but I can't tell you how extremely plowed. I I can't tell you how extremely proud I am of us, where we are, from the beginning of the semester to where we are now. We have learned a lot. We have grown.
I've grown a lot of patience. A lot.
Patience. And
I'm grateful for it.
Yes.
I remember the beginning of the semester. It was like an episode or two ago. I was stressing.
We're still stressing. No, we're still stressing. What are you talking about?
No, socially.
Oh, socially. Oh, yeah, girl. Yeah, that's a struggle bus.
Yeah.
But
now I'm fighting for study rooms.
That's it. Oh! Are you getting into that or no?
I could get into it.
Literally, the story won't take too long. Sorry.
It won't take too long.
Promise.
So I reserve a room. It's in the hallway. There's 10 rooms. I reserved room A, and I come to room A that was reserved from 12 to 4, and we got there at 11 o'clock, and somebody was reserving room A from 8 to 12. So I was there early. So the security guard came and was like, well, A is taken, so do you want B? I said, sure, I'll take B. So we come into B, we set up, we're there for already 2 hours, everything is everywhere. And somebody who reserved B comes, knocks on the door, opens it, and says, oh, this was my room. And I said, okay. Now, I don't know what came over me. I'm not usually like this. But she was like, this is my room. And I said, okay. Well, the room across the way, room A, is reserved. You can have it. Since we're in here, that room is the same. Same layout, everything. I have it reserved. Go take it.
Body language.
I said, I gave her everything, gave her all her options, but I said, the rooms are the same. I'm not moving, but I have a reservation available for you to take in exchange. She gives me a face, closes the door. I think that's the end of it. So I wait. If a few minutes passes, the knocking, apparently she didn't think it was necessary this time, just swings the door open and says, someone's in there and I want this room. So I said, oh, do you now? So I said, I'm gonna stay in this room, but we can have the security guard give you that room since you have a reservation and we exchanged and you can go and have that room because that person's not supposed to be in there. So you can have that room. So now she's standing there, dumbfounded or something, staring at me because I won't give up the room and now she wants to leave me without a room because she doesn't want to tell that person to get out, but she's going to tell me to get out. So closes the door, finally. and I get up and I lock it. Because you're not going to knock, you're just going to walk in. Like, what are you doing? So I'm starting to study again. 2 minutes passes and I hear knocking, 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 and I'm ignoring it.
And they're messing with the handle,
and
right?
she's shaking the handle. I'm like, what are you doing? Are you a psychopath? So I open the door and I crack it open and I'm go, can I help you? And she's like, someone's in the room. And I said, yes. And like, what do you want me to do about it? And I was like, go and tell them to leave. I don't like.
Right.
So as we're having this exchange of words, the security guard goes, I go, oh, good, you can tell him. And I shut it in her face and I locked the door. This is what I have to deal with. It's a study room. There's all the other rooms available, and you want this one? It's exactly the same. There's no reason to be like that. So that's what, and I had to go through that without my partner in crime.
I think the funniest part was when she said, yo, if you was here, that shit probably would have went down differently.
It really would have. It wouldn't have taken as long to make her go away. That's why. It would have been one pass and she would have been done. Had to take 3 times with me.
That's not the... Here, okay. In her defense, what I'm saying is that maybe she had an attachment to this room.
I don't care what attachment she had. Like, I'm sorry. I don't mean to come off this way. It was the situation
right
at hand. I had everything spread out. And you saw that the other room was open. And that somebody was in there and they weren't supposed to be in there. But you're going to tell me to get up all my stuff and leave when there's absolutely nothing in here that you would need?
That's crazy. It's crazy.
No.
Okay, so let's use this as a lesson. Real quick, run through it, right? You coming in, busting through the door. Your body language is already giving. You
already lost my respect.
You already lost respect because you're coming in guns blazing. There's no reason for that, okay? You ain't doing that. Number 2, your tone. You coming off a certain way, people gonna come and look at you sideways. Number 3, why are you insisting on knocking on the door?
Why are you shaking the handle?
Why are you doing that? Okay?
See, I could have been nice to you, but now I'm not gonna.
Now I'm not gonna. So
now I'm not gonna give you the room no matter what. The security guard gonna have to pick me up and put me
and fucking escort me out this fucking room.
You're gonna have to place me in room freaking A.
Oh my God.
If you want to be so bad.
But this is the thing, guys. This is what we implore to you. That same way you carry yourself.
Therapeutic communication.
The same way you carry yourself in the professional setting, please apply it to your personal. Please. We beg you. This is why people are walking around this world with a frown on their face. Malgada. You know what I'm saying? It's just like, don't come off like that. It would have been a better situation if you communicated and if you came across in the best way, say, hey, listen, that room across, like, I didn't realize that somebody was still in there. I really want this room, but if that room's not available, can I just go into a different room? Bro, done.
I already explained to her when she decided to come in, give me stank face, that I was in her space. I already said, I have a reservation in the room across the way. There was somebody in it before the time started. Okay, that's it. You should have been understanding at that point.
Nah. We have people that are in I don't want to say spoiled, but there's an entitlement.
Yeah, but that's just, I think that is how people of that age bracket are becoming to be like.
Yeah.
And that's not acceptable in healthcare.
No.
I don't care who you are. I don't care what you believe.
Nope.
You can't act like that.
You can't.
You can't be selfish in healthcare.
You can't. No. You're in the wrong field. And that is what we want to implore to you. If this is not the field for you, don't waste your time. Don't do it. You coming off stank face? Ain't nobody want to be working with you? No. Anybody want to talk to you? No. You want them to clean you? No. I'm good.
Yeah, I'll wipe my own.
I'll wipe my own. I'm independent. I'm A&O too. Fuck that. Fuck that. But guys, we want to thank you today for joining us on our journey. We want you to continue listening to the podcast. We want you to listen on all those past episodes. We're going to be talking about, what are we going to be talking about in the next episode?
Oh, the next episode, we're going to be getting down a little bit more into the nitty gritty about different types of assessments.
Ooh.
And SBAR.
SBAR. Yes.
Now, SBAR is not the only way you can
It's not.
communicate with other providers
It's
and
not.
other nurses, but it's very important. There's a structure to it, and we're going to discuss it next time.
Yeah. So on this next episode, we're going to be giving you all the tips, the bits, all that good stuff. We hope you enjoy this episode today. I'm your host, Stephanie.
And I'm your host, Ariana.
And you already know what happens on this podcast. Can you even imagine the stories and adventures each Scrubs can tell? Why? Because these Scrubs have got a lot to say. Thank you guys for joining us. Don't forget, we are on all the amazing listening platforms. We're on social media. Well, where are we?
We're everywhere.
We're everywhere.
Yeah.
We're everywhere.
We're everywhere, anywhere, and nowhere.
And no. We're nowhere. But you guys, you already know. And we will see you on the next one. Take care, guys. Bye.
Bye.